I'm speaking to you today because we're about to roll out our faculty performance assessment and planning tool across the college. We think this is a really important initiative because our faculty are the most important asset we have as an institution. We can't accomplish any of our missions without having outstanding faculty who are very committed to their progress. When we did a survey of our faculty, if you'll recall a few years ago, we got the feedback that many of you felt that we needed improved mentorship, better feedback, and opportunities for career advancement and career progression. And so as a result, we've spent the last couple of years developing a tool that will allow us to accomplish what you've asked for. This assessment tool is a holistic one in that it looks at career progression, it looks at academic development, it gives consistent feedback by your supervisor, all the things that have been requested in the survey. And it's very holistic. It looks at goals and expectations. It looks at competencies and a number of other assessments. And the idea in this kind of a tool is to see how you're coming along in your career. Are you meeting your expectations? Are you meeting our expectations, and making sure that they are totally aligned? And the hard thing about this, and it'll take a little getting used to, is we're used to being assessed on a scale of 1 to 5, 5 being great, 1 being not so good. This is really, do you meet certain levels of competency? So if our expectation is you're an outstanding clinician and you do outstanding work, that would be a 3. You're meeting the expectations that we have. So we'll get used to this together. This will be rolled out over the next few months. You'll be hearing from Dr. Alicia Monroe, who's the Provost and Senior Vice President for Faculty and Academic Affairs.
We're very excited about the faculty assessment and planning process that's about to launch. Over the past 2 years at Baylor College of Medicine, we've had the opportunity to take a deeper look at faculty affairs and faculty development, and where the alignment and the synergy could actually support faculty throughout their career. Faculty who are in the early season of their career, when they've just joined Baylor College of Medicine, and throughout those early years, to provide the support for their career, to provide helpful feedback to support not only their performance, but their continued development and evolution, so that they not only can have clear career goals, but have resources available to them to support that development over time. We also recognize that faculty who are mid-career, who have attained a fair amount of success and recognition, are still in the process of evolving and developing, not only as it relates to their academic and their scholarly and clinical achievements and their educational achievements, but also as it relates to their continuing to flourish and develop as professionals and scholars. I strongly believe that faculty who have attained the rank of professor, who may have been active contributors here for many years, will also find that this tool is really very useful, and it will give them some space to reflect and even reconsider how they might choose to reinvent themselves and add additional competencies and skills at this particular stage of their career. We feel very strongly that this new tool can support you wherever you are in the continuum of your professional career at Baylor College of Medicine. So one of the things that's really particularly novel and we're really excited about is the fact that we've actually added competencies into the portfolio of assessment that we're using. And all of you are very well aware of what competencies are, measurable behaviors. It's how we live out and walk out what we believe. They're tightly aligned with our values, and we believe that focus on competencies allows us to receive very helpful feedback, to enhance our own self-awareness and self-reflection, and it gives us an opportunity to continue to grow and evolve as professionals throughout the duration of our career. Certainly our first competency, which is teamwork, is tightly aligned with our institutional value of teamwork. The second competency, which is professionalism, which is very tightly aligned with integrity. Certainly to be a professional is something that's clearly important to every faculty member at Baylor College of Medicine. And how we exude and exemplify and model that professionalism for our trainees, with our colleagues, with our patients, in our labs are extraordinarily important to creating the kind of learning environment, patient care environment, and research environment that's optimal here at Baylor College of Medicine. We also think, frankly, because the world is changing, science is changing, healthcare is changing, that the ability to demonstrate that we can adapt to change is extraordinarily important. It's an important reflection of innovation. Innovation is not just what we produce, but frankly, it's who we are and how we recreate our ability to maintain our equanimity and our balance, our ability to remain calm under pressure, our ability to support others, trainees, staff, when frankly, the situation may be extremely controversial, there may be pain or trauma. Maintaining a results focus. We all know that we engage in our patient care because we want our patients to get better. We want our students to achieve and to graduate. We want our science, our experiments to work. So certainly our results focus is extraordinarily important as it relates to how we walk out our value of excellence. We strive for and model excellence. One of the ways in which we exude and frankly exemplify the value of excellence is our continued focus on results. Communication. We all know how important communication is. We know how valuable a soft word, how valuable encouragement, and how difficult situations can de-escalate when there are calm words, when there's encouragement, when there's the ability to listen, when there's the ability to value, when there's the ability to express empathy. Career planning is extraordinarily important. And this tool actually provides a specific component that creates space for faculty to pause and reflect about your career. And no matter where you are, if you're early career, if you're mid-career, or frankly, you're in a point in your career and you're ready for a transition, it gives you time to really think about and plan. We realize that goal-oriented individuals who are results-focused, if you've got a plan, you're going to get it done. So why not take time to think about your own career, prioritize it. It gives you an opportunity to pause, decide what competencies, what skills, how you're using your time, where you want to be, whether it relates to promotion, whether it relates to your national reputation or recognition or ways in which you want to contribute to scholarly programs. If you're interested in innovation and you want to commercialize some of your science, it creates a space for you to really think and plan. And the second and most important piece of it is after you've taken that time to plan, it actually creates the expectation that there will be a conversation with your supervisor about your plan. And not only will you be able to share your vision for your future, but you'll also be able to discuss what resources you feel like you need and what help you need from your department and what support, frankly, you would like for your evaluator or your supervisor to provide. So it provides time for planning and time for conversation and clear next steps that really can support the next phase of your journey. So in addition to the resources that your department or your division might be able to provide, or your evaluator or center director, there are resources at Baylor College of Medicine within the Office of Faculty Development. And if those resources are not already extant, you can help us through your feedback and your requests identify where there's a greater need so that if new programming is needed or additional assets, then we can begin to build those assets to respond to the faculty needs. So it's important for you to remember that both training and faculty development materials are here for you to help you to make the most of this experience. And we look forward to your feedback, and we are so excited that you will fully engage and maximally benefit from this process. Thank you.